Hello, this is Dr. David Greene, CEO of the TEX-PAIN Network. Today's topic is the basics of migraines. A migraine is a chronic headache that affects people from anywhere from a few hours up to 72 hours straight. It's a complicated, recurrent headache disorder that's most common in women and those between the ages of 15 and 55. Usually it becomes less severe and less frequent with age. Migraines affect 18% of women and 8% of men. 30 million people in the U.S. have at least one migraine annually. Every 10 seconds, someone in the U.S. goes to the ER with a headache or a migraine. 70% have a first-degree relative who suffers from migraines. If one parent suffers, there's a 40% chance a child will suffer. If both parents suffer, the chances go up to 90%. Over 90% of those who have a migraine are unable to work or function normally while it's going on. There's a lot we don't know about what causes migraines. We know there's some genetic and environmental component to it. One thing we do know is that there is an imbalance in brain chemicals. Serotonin levels have been shown to drop during migraines. This can trigger a migraine by letting too much blood flow through the vessels that should be constricted, and that's part of what induces the throbbing sensation. Typical migraine triggers, there are a lot of them. There's certain foods like aged cheese, red wine, beer, whiskey, food additives, cold foods, citrus fruits, MSG, and caffeine, to name a few. Elevated stress levels, weather changes, strong scents, hair accessories, exercise, poor posture, skipping meals, and smoking can all trigger a migraine. One small silver lining, there's no evidence to clearly substantiate that chocolate is a trigger of migraine headaches. It is a myth, thank God. Symptoms of migraine headaches often include a unilateral head pain that is throbbing and aggravated by activity. An aura is a visual or a sensory symptom prior to the onset of the headache. 80% of migraines have no aura whatsoever. There's no objective testing available for migraines. A CT or MRI scan can be done to rule out badness, such as a tumor, causing similar symptoms. It's diagnosed on patient history and pattern of symptoms. So when someone keeps a migraine diary with like the trigger and things like that, that can be very helpful. International Headache Society requires a patient to have at least 5 attacks fulfilling 3 criteria: 4 to 72 hour duration, at least 2 of these unilateral, pulsating, moderate to severe pain intensity, aggravation by or causing avoidance of routine physical activity, and at least 1 of these: nausea and vomiting, photophobia, and phonophobia. There are some abortive treatment options, which means while you're having the migraine to try and get rid of it. The triptans are the biggest market for this. They target the serotonin levels, which drop during the migraine. So here we go. Almotriptan, elatriptan, frovatriptan, naratriptan, rizatriptan, sumatriptan, which is the most common, and then zolmitriptan. There's additional ones such as nasal sprays, Migraine, Migranol, Cafrago, and there's over-the-counter medications: Advil migraine, Excedrin migraine, Motrin migraine. Additionally, treatment can consist of narcotics, barbiturates, nausea medication, anti-nausea medications such as Reglan, Compazine, or Phenergan. Then we get into the preventive treatment options, which are to try and decrease the frequency of migraines. And these may consist of off-label medications, beta blockers, calcium channel blockers, antidepressants, anti-seizure medications, and a serotonin antagonist such as Cinomigran. The FDA has approved Botox injections for chronic migraines that can be given at 3-month intervals. It's in a 10-minute procedure with injections into 32 sites. It's covered if certain medications have been tried and failed. For chronic migraines, you have to have 15 or more days per month with headaches lasting 4 hours a day or longer to be eligible. Patients treated with Botox averaged 8 to 9 fewer headache days per month compared to baseline in a very large study called the PREEMPT study. That's the study the FDA based the clearance on, approval on. There are a lot of different procedures also, such as occipital blocks, cervical facet injections, epidurals, sphenopalatine ganglion blocks, supratrochlear nerve blocks, supraorbital, infraorbital, and then pulse radiofrequency of the occipital nerves. Okay, here's some outcomes. In a study of 100 patients receiving greater occipital nerve blocks, over half, 53%, achieved pain relief averaging 3 weeks. This was a retrospective study on the efficacy of greater occipital nerve block in refractory migraines. A mixture of lidocaine and steroid was used for nerve block. 54% of migraine patients were reported on being significantly better after the blocks, and this lasted up to 6 months. Another study looked at the benefits of peripheral nerve blocks in the migraine treatment. They looked at 27 patients before and after greater occipital and supraorbital nerve blocks. They had a maximum of 10 injections and had an 85% effectiveness rate for 6 months. So the top non-operative pain management in the Dallas-Fort Worth Metroplex is through the TEX-PAIN network. There are several clinics throughout the area accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at painmanagementdallas.com and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Greene with the TEX-PAIN Network. Your pain stops here.